getting from the federal government every single day. That is the conversation that is at the front of mind for myself and the governor every day when we engage with the Biden-Harris administration, from which all these doses flow. We are working to make sure that then they get administered in an equitable fashion. And what I mean by that is the people and the communities that were hardest hit need to make sure they have access to the vaccine. And so we're trying to have, our plan is, it uses things like the social vulnerability index combined with places that we know were hard hit back in March and April of last year to try to make sure that we are addressing those specific needs of vulnerable communities with the vaccine and doing so as quickly as possible. I'm really thankful to have, Vice President Harris and President Biden on our side on this, as opposed to fighting with the White House like we had to do all of 2020. And just know that we're going to keep trying to ramp up. Our goal is to get 70% of people, adults in Michigan fully vaccinated. I'm glad that my wife, who's a Detroit Public Schools worker, she got her second dose last Friday. So that's great. We're going to try to have a minimum of 50,000 people in Michigan per day get one vaccine dose. And we are well on our way of doing that, as we've had now about a week straight of hitting that number. And we're looking to exceed it as we get more supply in from the federal government. The other thing we need to combat, though, is we need to make sure that people have the answer to their questions, or they have the resources that they need to make the choice to get a vaccination. A lot of people are hesitant for different reasons. Both the Black community and folks in other communities of color have not trusted large-scale medical preventions for good reason for a long time. I have questions about the process, have questions about what this looks like. And so we created something called the Protect Michigan Commission, which I'm also chairing, literally with the sole purpose of addressing this challenge. We want to get information to the community that is credible, that is accurate, to deal with all of the lies, distortions, misinformation that do exist about vaccines and vaccination broadly, and about the COVID-19 vaccines that are available specifically. I want to encourage everyone to be a beacon of information and a beacon of truth amidst all the crazy misinformation that is out here right now. You as leaders, people look to you for guidance. They look to emulate your choices and understand them. So as you become eligible and you decide to make the choice to get vaccinated, talk about that with your friends, families, neighbors, and coworkers. I'll be doing the same when it's my turn to be able to get vaccinated. I will be doing so very publicly. And in the meantime, I'm going to be visiting vaccine distribution sites across the state of Michigan to highlight the process and how easy it is to do. I even took my grandma, who lives in Southfield, to get her first vaccine dose this past week, and we're going to be releasing some photos and video about that, which is great. So I want folks to know that we have a role to play in making every day, week, and month in 2021 better than the one that came before it. We have a role to play. We actually have something that we can do. We have agency. This 2021 does not have to happen to us. We can make things happen in 2021. And so that starts with making sure that you're doing everything in your part to make sure that people are getting this vaccine, to make sure that people are still getting tested, to make sure that people are still wearing their masks and practicing social distancing, to make sure that you are highlighting the resources that we have for individuals, for families, and for businesses that need support during this pandemic. You can go to michigan.gov/COVID for information about our broader response, or go to michigan.gov/COVID vaccine to sign up for an appointment to get your vaccination. So thank you so much for having me today, and I want to thank all of you for joining this conversation. This conversation and ones like it in this community and across the state save lives. When we all work together, we can get this done. There is nothing that the people of our community, the people of Michigan, cannot do when we do it together. So please stick together, stand tall for one another, and let's get this done for all of our people so we can move forward into the big, bright future that we're all excited about. So thank you for having me.
Thank you so much, Lieutenant Governor Gilchrist. We know how hard you're working as far as for all the communities in the state. We appreciate you taking time out of your busy schedule to be here. Our next speaker is Dr. Natasha Bagdarsarian. She's a senior public health physician with the Michigan Department of Health and Human Services. She earned a master's of public health and molecular epidemiology, completed internal medicine residency and infectious disease fellowship at the University of Michigan. She's also consults with the World Health Organization on international outbreak preparedness. Since July 2020, she served as a senior public health physician at the Michigan Department of Health and Human Services, where she provides input on communicable diseases, outbreaks, and pandemic response and public health policy. We're extremely glad to welcome Dr. Bagdarsarian.
Thank you for having me. I know my intro is a little bit of a tongue twister there, so thanks for that. I thought I'd give a little bit of the science behind the vaccine, and I'll only speak for about 5 minutes, but I do have some slides that I will just really quickly share. So I'll talk about the 2 vaccines that we have available here at the state and around the country as well. The 2 vaccines right now available are the Pfizer and the Moderna vaccines. They really utilize the same sort of technology. They're both mRNA vaccines that need 2 doses, and they're both extremely effective, up to 95% effective, and very, very safe. The biggest difference between them is that the Pfizer vaccine has to be stored at ultra cold temperatures, whereas the Moderna vaccine just has to be stored at cold temperatures. There's a little bit of a difference in terms of which ages they got approved for and when the second dose is due, but otherwise they're very similar. In terms of vaccine side effects, the side effects are really similar to vaccine side effects that you would see for any other vaccine. So a little bit of pain where you get the injection, maybe some headache, fever, fatigue, chills. I can report that I've had both doses of my Pfizer vaccine, and other than feeling a little bit tired after the second dose, no issues. There has been a lot of attention and a lot of buzz about how quickly these vaccines were created. And so I just want to quickly tell everyone on the call that the vaccines actually went through all the phases that a vaccine normally has to go through. So phase 1, phase 2, and phase 3 trials. And in these trials, they were literally given to hundreds of thousands of volunteers. And now have been given to millions of people around the world. So we know that these vaccines are exceptionally safe, and they're really our best way to exit this pandemic. How do these vaccines work? I won't go into too much of the detail. It's fantastic technology. This is not technology that is new and has been created in the last year. This is technology that people worked on for years before we had even heard of COVID-19. So a lot of efforts went into this, this technology, and I think it'll help us with future vaccine creation. In terms of the timeline, we're doing a very targeted and nuanced rollout to make sure that certain vulnerable populations and sectors have been protected. And so that's why the vaccine just wasn't opened up to everyone at the same time. In the beginning, it was open up to healthcare workers and long-term care facility residents and workers, because we know that we've got to keep healthcare open. We know that the outbreaks were happening in long-term care. Since then, we've opened it up to some essential workers, including teachers, and now adults over the age of 65. And this is the same way the rollout's going to keep going. We'll keep making it available to other sectors of society. For those of you who are looking for more information, we do have a website on michigan.gov for the COVID vaccine. And there's all kinds of information here that's helpful. You can find a site in your county, and you can also access the state's data. And I'll just give you a little look at what that looks like. You can see how many doses have been administered over time. And I pulled this just this morning, and you can see we're at 1.5 million doses, which is amazing. And so a big thanks to everyone who's been working on this. For more information, here are some resources, and I can put these in the chat as well. Our COVID-19 hotline, as well as our vaccine website. I'll stop sharing now and hand it back over to our hosts. Thank you.
Thank you so much, Dr. Bagdarsarian. We appreciate that. And I'm glad that you're able to stick around for our question and answer period. Right now, I want to introduce everyone to our esteemed panelists. First, I'd like to introduce Reverend Dr. Teleah Phillips. She's a proud native of Flint, Michigan. She did her pre-medical and honors student thesis on cultural competency and disparities in healthcare for minorities. Reverend Dr. Phillips is a graduate of Michigan State University College of Osteopathic Medicine, currently serving the Albion, Michigan community as a family practice physician with Oaklawn Medical Group. We also have Dr. Oveta Fuller. She's an associate professor of microbiology and immunology at the Medical School and Family in the STEM initiative of the African Studies Center at the University of Michigan. She's adjunct adjunct professor at Payne Theological Seminary and ordained elder and former pastor of the African Methodist Episcopal Church. We also have Mr. Andrew Cox. He's the director of the Macomb County Health Department. So with that, I'd like Mr. Cox to please take it away and give us the insight and overview as far as what's going on at the Macomb County Health Department.
Good morning, Joel. Joel, thank you so much for having the opportunity for me to talk, and I always enjoy the opportunity to answer any questions that come up. So I'm just going to give a quick update on our response so far here at the health department. But before I do that, you didn't have my bio, but I'm a Spartan grad, so go Spartans. I think Garland Gilchrist is off, so I think it's safe to say that now because he'd probably jump on me with his, being a Wolverine. So I think it's safe now. But so we have here at the county, we've been doing our vaccination site at the Verheulen site here. It's a county-owned building, and so we've been able to set that up. That site to date has done 37,000 doses at that site alone. So very proud of our folks. A lot of our staff have been working tirelessly to vaccinate people. We know there's some people that are frustrated with the scheduling component because there's such high demand. When we opened it up on January 9th to the additional priority groups, we had well over 100,000 people trying to get appointments. And that's continued to be the case every single week when we know how many doses we've been allocated. Typically, we're getting between 4,000 to 5,000 to 6,000 doses a week. So it shows you just how much demand and how far those doses go. And we're not unique to that issue. I think it's something that we're seeing across the state and across the county where there's just not enough doses to go around. But we don't want to stop there with just having one site in the county. And so what we've done is look at partnerships in the community. We've opened up a site in the north end at Richmond Lennox UMS for a drive-through, just because the folks coming through our site currently are mostly seniors, 65 plus. And one of the things has been transportation and also accessibility of the site. So it's very hard for some people to walk through the site with a walker or being in a wheelchair. So we wanted to give that drive-through option. We're working on a south end drive-through. We had a site, but unfortunately that host had to back out because of commitments and staffing commitments. So we're hoping soon to get another one up and running. But in addition, what we've done is partner with Meyer, who will build a registry. And what we'll be able to do is actually target certain zip codes with the highest SVI and invite those people with those zip codes to get vaccinated. I can't tell you exactly what Meyer stores they are, because it's been a request that we not share that publicly, because they've had issues at other stores statewide with people showing up to the store wanting to get vaccinated. So it's been something that we've agreed to do. But I would encourage everybody to go to the Meyer site and get registered to promote getting vaccinated. We're currently looking at other ways that we can go. We've done some congregate cares, the residential homes for nursing homes and assisted living facilities that we all know, we're one of the highest for death rates in the county and statewide, and really suffered disproportionately. As such, our minority populations as well. So we want to make sure that we targeted congregate care. And so we've gone in with strike teams with our own staff and partnering with local EMS agencies to go in and hit these facilities. We've got about over 60 facilities that we're going to get to. These are facilities that were unable to join that partnership with CVS and Walgreens. And so we're going to go into those facilities and get those most vulnerable populations taken care of. So we'll continue our vaccination efforts. I do want to mention that we have not stopped our testing efforts as well. I know this is more focused around vaccination efforts, but we can't we can't stop testing and testing availability. So we continue to do our drive-through testing site in Clinton Township at the former Baker College, just off of 16 Mile in Gratiot. But we're still also partnering with Wayne State University Physicians Group to do testing 2 days a week in Warren, and then we also partner with Access and now ACC to do testing in their communities as well. So we're very proud that we've continued to do that. We've been doing it since last year in 2020 when we began, and we'll continue to commit to that testing to offer no-cost testing to residents in different communities around the county. We continue to do, obviously, contact tracing as well. That has not stopped. We've been going as the health department since March, and so we will continue to carry on. The staff tirelessly take phone calls from residents and answer questions, but I'll tell you that they are still very positive. They like helping the community and look forward to it. And so we're going to be there, and I look forward to working with other community partners on other ways that we can reach our communities. And I think I'll stop there, Joel. Thank you.
Thank you so much, Andrew. Now what I'd like to go to is just for a brief opening statement from Reverend Dr. Teleah Phillips, please. Oh, I've got to unmute her just a second. I'm not exactly Mr. High Tech, so it'll take a second.
Good morning, everyone. So honored to be with you all and to share in this opportunity to cultivate an environment that promotes access, information, and hopefully well-being. And so just looking forward to hearing the questions and being able to provide some responses that hopefully will give some peace and some reassurance and insight so that our residents and the whole state can feel empowered to make a decision for their health.
Thank you, Dr. Phillips. Please don't mute yourself, because this way, no, it's just that we'll go into this after. First, we'd like to hear from Dr. Fuller. If you could give a brief opening statement, please. Thank you.
Yes, good morning to everyone, and thank you also for hosting this very important forum and for inviting us to be part of it. Some of you know I'm also on the FDA panel that reviewed the Pfizer and Moderna, and we have looked at now about 8 weeks of rollout from the time of the clinical trials that Dr. Bagdarsarian talked about. And one of the things that's really comforting to me to know is that what was seen in the clinical trials in terms of side effects and what was described is actually what is being seen, at least what's being reported to the CDC. So my confidence in the safety and the effectiveness was never a question of these vaccines has really gone up in that 8-week period, which is what I wanted to happen anyway, to sort of give us a little bit of time to see what happened in the rollout. So I'm delighted to be here, and just to say there are still some Wolverines in the house. And my husband is a Spartan, but he graduated, he teaches at Michigan State, but he's also a Wolverine at heart. So don't get too comfortable there, Mr. Cox. Thank you all. We look forward to your questions.
Thank you so much, Dr. Fuller. Really appreciate it. Now, since you know everybody and have heard from all of our panelists, we'll start the Q&A. What I ask everybody to do is put all questions in the chat, please. That should work, and then I'll ask them. Everyone except the panel will be muted unless for some reason it's not working and we have to unmute you to speak. It's just so that way we don't get a lot of crosstalk and people talking over each other.
Joel, before you get started,
yeah,
a couple of people have sent, I'm sure it was accidental messages to me privately in the chat.
Okay.
So once we get to that point, I'm trying to think, I don't know if you can even see that, probably not.
No, I tell you what, Mary, just go ahead and if you want to go ahead and ask.
Start reading?
Yeah, just start reading. Okay. And then panelists, what I ask is whoever wants to take it, we've got a half hour roughly to do this, so we'd really, really appreciate it.
Okay, first question is, there's been discussion of the pandemic becoming an endemic. Can you elaborate on this? Are there findings that this virus might require an annual vaccination? And that question is from Riola Hammond.
I guess I can take that one. So a pandemic or epidemic is when it's in multiple regions or around the world. And for those who don't know, an endemic is where it's localized to a general area, if I'm remembering my public health correctly. And so what likely will happen is we imagine the end game with COVID is that we will coexist with COVID. And ideally things like having people vaccinated, having people with having herd immunity, having folks practice the preventions of masking and other ways, staying home if need be, contact tracing, as was mentioned, will keep the virus down to such a low level that we can manage it by contact tracing and testing and isolation and quarantine. In that case, it will be endemic places where the virus may, there may be a surge in a local area, but because of the testing and because of the things that are going on, we know that, and then that area can do what's necessary to make sure that the levels go back down. So at least in the science world, we imagine that we will be coexisting with coronavirus, and the sooner we can get it under control, the sooner we don't have to worry about so many variants coming up, et cetera. So probably, if indeed, we don't even know how long the immunity lasts, but the scenario of an annual vaccine or every 2 years or 3 years or whatever would seem very feasible. And our Dr. Bagdarsarian might have further comments on that, but it might become endemic. I just don't want it to become endemic in the populations of color because we have not used all the tools available to us to stop it.
Okay,
I would just like to echo what Dr. Fuller just said. I think that was a really great explanation. And I would say for those of us working in the public health world and infectious disease world, we do expect to be coexisting with this virus, with the SARS-CoV-2 virus in the future. It's really a matter of how much can we build up our herd immunity and how much can we prevent large scale outbreaks from happening. And so the more people who are immune to this virus and the more people that we can protect, the less likely we are to have these large scale transmission events.
Is that it on that one? Okay. This question is, why is City of Detroit receiving more vaccines than any other county? Mayor Duggan stated that he's getting 15,000 vaccines per week. Why?
Honestly, Mary, well, Andrew, do you have any idea about that? Because I don't want, to put anybody in a position that they're trying to answer something
that they don't know. I get it. That was the question
Right.
that was in there.
I think those are questions that, the state could possibly answer. What's been described to us is that the state is using what Garland Gilchrist highlighted is the SVI, the Social Vulnerability Index, to do a multiplier based off the populations. I've not actually been able to see or get the numbers exactly, but that's what's been described to us on the local level. So I can only speak to Macomb County's allotment and the numbers that we've received.
Okay.
Very briefly, that's the pattern that's being used, encouraged nationally, that the most vulnerable sites, the sites where there have been more cases, would be the priorities to push vaccine to. So I can't answer why the City of Detroit, but that fits that pattern of what I understand by the Biden and Harris administration.
Another factor that is considered in the process, and I just know this because we're dealing with the process of administering the vaccines in our space, is that it is extremely important to continue to have these types of conversations with our communities and to cultivate utilization of the allotment that's given. Because the sites have to report what percentage of vaccines are actually being distributed and utilized. And so if there is a discrepancy in how many were given versus how many were used, then the distributors are decreasing the amount that are being distributed to those sites. So please continue to advocate for and encourage the utilization, encourage our communities to get vaccinated, because we do not want the situation to happen where our communities our sites are receiving vaccines, but we have nobody to give them to. And we've been in situations where we've been scrambling to call and try to get people to come in so we're not wasting doses. So please continue to promote it. I know that frustrations are happening with people waiting, and we don't want that anticipation to get it to start to wane, but to continue to press and encourage people to hold on to hope in this process until our allocation matches our demand, if you will.
Thank you. Go ahead, Mary. You've got one more, and then I've got some here.
Oh, I've got a ton of them.
Okay, well, here, let me get mine out of the way here. I know Senator Paul Bueno was asking Dr. Fuller, when you look at the data from vaccine adverse reporting system, are you seeing any unexpected trends?
So what I've seen is what comes from the CDC in data. So I can't say that I have the privilege of knowing the unique things. And I know there are reactions that occur, but if you look at what the side effects were reported to be in the clinical trials, and that they were from none for some people to quite serious for 2 or 3 days, or I shouldn't say serious as in life-threatening, but serious as to not being able to function very well for 2 or 3 days. That's what was described in the clinical studies. And that's what my friends and family and others who report about what happened with the vaccine, that's what we're seeing. There may have been a few cases that are outside of this. And another point is it's so important to register with VAERS, the Vaccine Adverse Events group, when you do get your vaccine, and then answer that survey, which comes to your phone, because that's how the data are collected to let us know what's happening in the rollout among millions of people. So there have been a few things, but I don't know anything that's been traced directly back to the vaccine, and others may speak further to that.
Yeah, one of the things that I talk about with my patients when we talk about the vaccine, I typically try to use the word response versus reaction, because that term response helps really solidify in their minds that we expect their immune system to respond to this vaccination process. And a response is not necessarily a negative thing, and it's definitely not in this case, because we want our immune systems to respond to the vaccination. That's how this immunity and this protection happens. So we do try to encourage the term response versus reaction. And in practice, we are seeing the scope of response. There are several patients who have no symptoms, not even a sore arm. And then there are patients on the other end of the spectrum. And I think the best way to just really kind of avoid this mistrust of the system is to be honest and transparent, so that there is clarity for the patients that are receiving the vaccine to know that they can anticipate a response. So that way they're not surprised or thinking that the response is something negative. They can prepare themselves for that. And then the other thing I'll say, in some of the communities that we serve, I love the response reporting system, but we have lots of patients who are not tech savvy, who don't use computers, who don't have access to that reporting system. And so for those patients, we're telling them, tell your doctor, communicate that with your healthcare practitioner, or if they don't have one, with the local health department, so that at least their information can be heard and known, so that we can factor that into the conversation as well.
May I just follow up quickly also? One of the reasons that I mentioned this is because there are people who are getting vaccinated. They get that card to say, people who are tech savvy, they get the info, but then they don't connect to the VAERS. And so either you do it or you do it for someone, or as Dr. Phillips has mentioned, tell your health provider. But that feedback is so important to know what's really happening in the real world.
I would just like to echo what Drs. Fuller and Phillips mentioned. So there have been, and I really like phrasing this as a response, because these reactions are a sign that your immune system is working. So we really want people to feel a little bit achy and run down after their vaccine. But there have been there are large scale studies that are underway right now looking at patterns of adverse events after vaccine. So looking at things like death after vaccine, and there does not appear to be any increased likelihood of things like death after vaccine versus those who have not received vaccine. So it's all very, very reassuring data.
And one more thing, there's a video, there may be many going around, but there's one in particular that I've been sent by multiple people that looks at the FDA data and says, even in the clinical trials, people died and participants died. Well, out of 44,000 people and 30,000 people in the Moderna and 44,000 the Pfizer, so that report, that video is a distortion of the truth. Yes, there were people that died over a 4 to 5 month time, but they were random across the vaccine and the control group. So you can't say these people died of heart attacks or whatever because of the vaccine, because people died in both groups. So that's a case of somebody having some data, which is very precise and very exact, but then in interpreting it wrongly and misleading people to think that the vaccine is causing those deaths. So I just want to put that out there. So you have to be wise when you hear these things.
Thank you. I'm going to ask a question from Commissioner Mindsong. We have a diverse community and residents in Michigan, and specifically Macomb County. Are there any plans to offer language access services, translated material, education, inform the community in their native language, and interpretation services for administering the vaccine?
Yeah, it's a great question, Commissioner. We already have some materials. We've had contracts in place with translation services and community partners to translate materials. So we have that already in several different of the major languages spoken and utilized in Macomb County. So we have that already, and we'll continue to work on that to get that specific material. But if there's anything in particular, please, I'm going to put my contact information in the chat. Email me and contact me to let me know if there's specifically documents that would be helpful.
Great, thank you, Andrew. Mary, it seems like you got the majority of the questions, so please proceed.
I was muted. There was one that was, I got to go. Oh, in regards to essential workers, why are not the postal worker and automotive worker not included? The homeless community, how will the COVID task force reach out to them?
Yeah, I can help answer that question. It has been a real struggle trying to figure out these priority groups and who are some of the people who should fit into the priority groups. And the unfortunate reality is there are not enough doses of vaccine right now to immunize everyone whom we want to be immunized. So in a perfect world, yes, we would want to include postal workers and people working on the auto lines, and we would want to vaccinate everyone who is going in to do their job right now, people working in grocery stores. Unfortunately, the doses are not there yet. And so it does mean that having a little bit of patience and waiting, the doses are coming. Production is being ramped up. The Biden administration has really been working with the vaccine manufacturers to ramp up dose production. And also we've got a new vaccine that's coming down the pipeline soon. The Johnson & Johnson vaccine will be here soon, and it does not require special cold refrigeration. So that is a light at the end of the tunnel that is coming. But in the meantime, there will be some groups who are not able to be vaccinated until a little bit later. And it just means we've got to double down on all those mitigation practices, wearing your mask. Now there's some information about wearing 2 masks, maybe more protective than wearing a single mask. If you've got a face shield at home and you want to put a face shield on top of that, that may offer some benefit as well. So in a perfect world, yes, we would want to vaccinate all these individuals. But the reality is the doses are not there.
If I may echo the emphasis on these mitigating practices that we really have to continue to strongly push as physician in practice every day. I spend 90% of my day talking about COVID, honestly, in addition to everything else. And one of the things that I feel like is starting to get lost as we predominate our conversations about vaccines is these other practices. And so, as we know, the vaccines aren't there yet, but there is some things that are here right now that we can do. I was just reading that journal article about the efficacy of double masking, if you will, whether it's a medical mask with a cloth mask on top of it. And one of the statistics was 40% versus 80% protection and coverage. And so that's significant. And if there were two persons that were double masked, there was like a 95% protection process. So please encourage the communities to continue to mask, to make sure that the mask is properly fitted. It does not work if it's underneath your nose. Some of the things that are on the CDC website help give some specific guidance about that. So please make sure that you're masking, yes, but that we're encouraging our communities to properly mask and to continue the hand washing and the social distancing because it's necessary in this season while we're waiting for the vaccination process to continue to move forward.
May I just add to that something that both of our panelists have already said, is that the vaccine is a tool in a toolkit. And thus the contact tracing, the isolation, the masking, the staying home if you don't have to be out. And here's a key issue. The vaccines, Pfizer and Moderna, as far as we know from the trials, protect against disease and symptoms. They stopped that wonderfully well. 95% of the people in the vaccine group did not have disease and symptoms. But neither of those studies showed whether the vaccine protected against infection spread. So in other words, I could be vaccinated and still have virus in my nasal passages that I breathed out to get to somebody who isn't vaccinated. And so with or without the vaccine, now and in the future, we're going to have to use the preventions to keep the virus down. This virus isn't trying to hurt us, it's just trying to reproduce itself. So even when it reproduces without causing disease, if it reproduces, we still have it circulating in the community and thus available to vulnerable people. So vaccines are not a magic cure, they're part of the answer. The rest of the answer is what we have not done very well in the US, which is use the preventions we already have. Masking, staying distance, washing our hands, and staying away from each other and at home when necessary.
Thank you. The next question is, and I'm not sure if anybody here would know that, but they said, when does the state expect to open it up to people under 65 who are at extremely high risk or on ventilators? Anybody have any idea on that?
I can answer that. I can't really provide the specifics of which phases are coming next. There will be announcements, so stay tuned. But in general, the way we do this is going to have to be a little bit nuanced. And so, for example, someone who is currently ill with COVID and on a ventilator may not be the best choice to receive the vaccine at this moment. So there's a lot of thought going into this. You will be hearing more information as we open up other categories and as we provide further recommendations. But a lot of this hinges on how much vaccine the state will be receiving and when this new Johnson & Johnson vaccine gets approved.
Okay, thank you. Someone asked me the other day about something, and I thought this had been more or less put to rest, but I would like your response to this, please. Someone asked me, was it actually the COVID virus that they were getting in the injection? And I know that's been discussed, but if that's something that, you know, you could just break that down in layman's terms so that people understand if they get that kind of question, what's the appropriate response, please?
I can take that one, and I'm sure Dr. Bagdarsarian could too. But so vaccines are either made of a virus that's been weakened or that's been killed through radiation or some other chemical form, or they're subunits. And in this case, these messenger RNA vaccines are, they're a new type, but they're a subunit vaccine. And the way I've explained it before is that if my fist were the virus, if that were coronavirus, with some vaccines like flu or even measles, mumps, you get the whole thing and your body makes an immune response to that. Here, we're only putting in the material, the code that allows you to make a portion of that. In that case, I'm saying my thumb is the spike protein. So we're putting in the code that will actually deteriorate in a few hours after it's in your body and in a cell to allow your cells to make this spike. So you're only getting a very small piece of the virus, but it's a very important piece. And that then, when it's expressed on your own cells, allows you to make an immune response that will protect you from when you see the real virus. So no, we're not putting virus in. What goes in is the messenger RNA that's synthesized. It's actually made to copy the virus sequence, plus salt, plus sucrose, and plus some stabilizers such as PEG. And it's sometimes the PEG or that some people are allergic to because it's found in many vaccines. So if you've had a reaction to another vaccine, you might have a reaction to the messenger RNA vaccines. But there is no virus in here. There's no way this can give you the disease. It's one of the safest technologies and easy to manipulate technologies. And it's been researched now for about 12 years. It's just coming together to be applied to COVID because different pieces, different researchers put their data together to make it happen. So there is no virus in this vaccine.
If I could just add on to something that Dr. Fuller just mentioned, agree with everything she said. I also want to say that if there is one single bright spot from this pandemic, it is the technology behind these vaccines. This technology is basically a way that we will create vaccines for other diseases, even some non-infectious diseases. So if there is one single good thing that has come out of the pandemic, it is these vaccines.
Great, thank you so much, because that certainly helps so that, to get the people here to understand, but also when we're asked questions, it's just
Right.
a way to be able to explain it so that people can understand that, no, you're not getting COVID in your arm from the shot. Mary, you have more?
I actually had a message out there I was trying to send to everyone, and I didn't. This one says, do we know how many people are willing to take the vaccine if we are only registering folks for specific appointments? I would hope that everyone takes the vaccine, but we know, of course, that will not be the case.
So how the system will work is they sign up for, if they're interested. We can't, obviously we can't require people to get the vaccine. So typically these are people that are interested. They always have the option of declining if they do not want to go that route. But typically we've only, most of the time when we run typical vaccination clinics, we will see, cancellation rates up to 15 to 20%. With COVID vaccinations, it's less than 2% right now. Everyone that makes an appointment is coming to their appointment. And so hopefully that answered your question.
Okay, I am. Dr. Fuller, you had a question out there about the plan. You addressed it to everyone. I'm not sure what it meant.
I was answering the question that was in the chat that I think had been answered before. So it was a question that had come up about something. So.
Okay.
Oh yes, no, I remember. I know. Was the Macomb County plan that Mr. Cox described for distribution also just for Macomb County, or was it being utilized by other counties as well when you gave your overview?
Yeah, so it's a really great question because it's a little confusing when it comes to all the different efforts going on for vaccinations. So some of these are federal partnerships directly with the pharmacies, like the CVS Walgreens partnership to go into the nursing homes. That's a direct partnership with those pharmacies directly. So that's a direct ship to and separate allotment than what the state is getting. In addition, now the Biden administration has approved another partnership, a federal partnership with different states. The states were the ones that picked the pharmacy partners for our state, Rite Aid Pharmacies, Meyer, and a smaller chain, Cardinal, and the UP have been chosen for allocation for this program. It's still limited supply. Very small amounts are going out to these partnerships. We don't have a whole lot of information for the Rite Aid yet. I think that's forthcoming hopefully this next week. The Meijer partnerships that I was referring to with the 2 stores are direct partnerships that we engage with Meijer. So that is our allotment coming from our allotment from the state, not the federal partnership.
If I may just add a comment about that process in practice. When we're communicating with our communities, it is important to help them understand, because there's so many different potential sources for sign up, that it is really important for them to communicate. Because I heard Mr. Cox say that, you know, he's getting great response when people sign up, they show up. That's not necessarily always happening even in the clinical practices, because a patient will say, oh, I didn't show up because I got it at Meijer, or I didn't show up because I got it at the health department. Well, we don't know that. And so it is so important to make sure that we are communicating to our communities that, yes, if you need to find a spot on multiple waiting lists, we understand that, but please communicate once you get it with the others so that we can utilize that dose and that time slot for someone else. So we see that that's happening across the state, but it's really important to make sure that there is this communication happening. And it's hard to communicate between health systems. It's hard to communicate between the health department and another health facility. So it really is important for the patient to be the one that's reaching back to say, I've had it, I don't need it, give that shot or dose or time slot to someone else.
I think that's a huge challenge and undertaking, Dr. Phillips, that not only you, but the healthcare systems have struggled with it, even other counties. I'm not going to say that ours is the right system, but this is one of the reasons why when we open up our appointments, we just do it for a week, because that's what we know we have. We never want to cancel appointment clinics. And there have been some, unfortunately, I think, that other partners, and it's not wrong, it's just the system they built. And so I think one of the things that why our percentage is so low is probably because that is the practice we do. We open it every week for the doses we get. So typically people are responding pretty well, but I echo your sentiments, because we often hear people have 4 or 5 different appointments or registries they're on. So that is great advice.
And tell your community constituents in that process, just because people get frustrated about the allocation, most of us who are allocating the vaccine, we don't even know how many we're getting until almost that Friday before that Monday. And so it's not that we're holding out. It's not that we have some secret stash that we don't want to give or only want to give to certain people. We literally have no clue how many we're getting until that Friday typically. So just let them know we're trying to get out information as soon as we get it. It's coming when it comes.
Mary, did you have anything else?
I did not, unless I've got a lot of comments, not questions, and most of those were private.
Yeah.
And I was just typing a thank you for everyone who was able to join us today. Really appreciate that. And all of our elected officials. I understand we only had an hour, so I'm trying to say this as quickly as possible, which is why I was trying to put it in the chat.
There is a question in the chat about symptoms, if you want that answered.
Oh, someone just, they just put it in there.
Right, so people who've had COVID are encouraged to get the vaccine, but wait till at least, I believe it's 14 days after the diagnosis, or after your last clearance of symptoms and fevers or anything, and perhaps others can speak to that. But let me simply say that the immunization that comes from infection does not seem to be as strong as the protection that comes from the vaccine. And that's probably because the vaccine, remember, is directed to that specific spike that is the key attachment protein of the virus. So it's a very targeted immune response. Whereas when you get the virus, you're responding to the whole thing. And that response is not as strong and as protective, which is the key element of vaccines. So yes, if you've had COVID, you should wait until you're clear from it, but then get the vaccine as an additional protection.
Absolutely, absolutely.
Great, thank you so much.
That hasn't been mentioned, and it's possibly because people just aren't aware. There are many recommendations for people not to get the vaccine, just so you know. So there's been questions, well, if I'm lactate or if I'm nursing, should I get it? If I'm pregnant, should I get it? There are not very many recommendations for people not to be vaccinated. And then the other thing I'll share is that there is something called a monoclonal antibody. So when individuals have COVID, we'll sometimes use that as a potential treatment. So if there are individuals who did receive that treatment course, we are recommending or have been recommending that they wait a certain amount of days. And so that's one of the only timeframes in addition to waiting till it's cleared that have been given.
Great.
One real quick question. What is the plan to get the vaccine in the jails and prisons?
We have already been sending vaccine to prisons around the state, and Michigan National Guard has been there vaccinating both inmates as well as staff. So that's already happening and will continue to happen.
Thank you.
Joel,
Now,
can you unmute?
Hold on, Mary, because we're almost done. And I want to make sure to thank Dr. Bagdarsarian, Dr. Fuller, Dr. Phillips, Andrew Cox, but I have to send a special shout out to Dion Williams from Governor Whitmer's office and Natalie Dean Wood from Macomb County Health Department, who really helped us put everything together and bring the doctors on board and get all this great information out. So I thank you for your time. I would just say this: if people have additional questions, you have Andrew Cox's email, and I'm sure he can forward that up as far as through the state or reach the doctors and things. And any, further questions you come up with, we certainly want to, follow up on. The other thing we want to do is to make sure that we're able to do this again. So I want to thank everybody, and, enjoy the rest of your Saturday. Enjoy the snow out there. Of course, this is Michigan, but thanks again. And I got to thank my partner here, Mary Hall-Rayford, who did a great job with that and trying to keep up with everything. So thank you, everyone. Have a great day.
I try hard.
Thank you.
Have a great day.
Thank
Bye
you.
now.
Thanks, everyone.